everyone, welcome back to this channel. Today I want to have a brief discussion about some pec minor stretching. I know there's a lot of stretches out there that focus on stretching both of the pec minors. I'll show you a unilateral stretch today, focusing on one side at a time. This is a very common problem that needs to be addressed if you have thoracic outlet syndrome. I'm not a big proponent of stretching, as many of my followers might know, but there's a couple of exceptions, and the pec minor is usually one of them. So I often recommend careful stretching, gentle, careful stretching of the pec minor 2-3 times per week for a good 60 seconds to 2 minutes per time. So let me show you how I perform this stretch. I've had good results with this with my patients. Some quick information on pec minor tightness in general. Why does the pec minor get tight? Well, the most common reason for this is poor, either being very tense, so the patient is tense, clenching their pecs a lot, often combined with having low shoulders in posture and scapular dyskinesia. So they're pulling that shoulder forward and down when they're articulating with the arm, rather than keeping their shoulders up and having their scapula articulate appropriately. So, without further ado, let me show you how to perform this stretch. Okay guys, I hope you can see this. The angle is a little bit off, so it's not that easy to get it on video, but you want to get the pec major out of the process. How do you do that? Well, you do internal rotation, okay guys, because the pec minor is attached to the coracoid process, whereas the pec major is attached on the lateral aspect of the humerus. So when you internally rotate the humerus, you relax the pec major and makes it much easier to get that pec minor. Now, for the pec minor, what we're going to do is that we're going to elevate the shoulder blade. We are not going to pull the shoulder back and down like many advocate. That is wrong. It is detrimental. Should not be done because you put the collarbone into the brachial plexus. We're going to keep the shoulder blade up. We're going to raise the arm with internal rotation, maximal internal rotation, so the thumb is pointing forward. And then, as I said, the pec minor attaches to the coracoid process. So we're going to use the arm as a lever to pull that scapula back, and we're going to lean. If my arm is up here, I'm going to lean in and slightly medially, guys. All right. So lean forward and slightly medially, and that will pull the coracoid this way and give me a nice stretch of the pec minor. You do not want this to hurt. You want it to be a little bit uncomfortable. If you're having more symptoms afterwards, you're going too hard, guys. All right. So maximal internal rotation, shoulder blade is elevated. I'm using the dorsal aspect of my thumb, placing that towards the doorway, and I'm gently leaning into it, guys. And you want that to, well, it should not hurt. You should be slightly uncomfortable. You should feel the stretch, and you hold that for 60 seconds or up to 2 minutes, 2 to 3 times per week. That is my recommendation. So I hope this was helpful. This is a useful thing to do for people who have a lot of pec tightness, vascular symptoms in the arms, especially if your pulse goes away when you raise your arms, or you get very cold hands when you shouldn't for no reason whatsoever. It might be that your pec minors are very tight. Good solution for that: do pec minor stretching, keep your shoulders up in posture, confer to my other videos on this topic, and work on your scapular movement, guys. So I hope this was helpful. Have a great day.